Telehealth could be the buzzword of 2020. But what is it?
It comes down to bridging the gap between patients and providers.
Simply put, you can see your doctor from anywhere using a tablet, a phone, or a desktop computer.
Having that ability to access telemedicine from rural areas saves a lot of time and money and effort.
And most primary doctors are now embracing the technology.
For family practice, I think it's an ideal tool.
It's not just office visits. Telehealth is proactive healthcare, thanks to remote monitoring services.
It is a real game changer for how we're going to be able to deliver care and really help the patient do better.
Your doctor can track things like your blood pressure or heart rate and get alerts if there's an issue.
Long-term, telehealth will be used to reduce cost of care, improve quality, really be more proactive in treating the whole person.
Learn more at connectednation.org/telehealth. Telehealth. It's an easy way to see your doctor
I would definitely be using telemedicine in the future.
and for your doctor to monitor your health from afar.
It really is the same as me being in the office.
However, in a Connected Nation Michigan study, 43% of respondents worry health issues may be missed or misdiagnosed, but doctors say they'll let you know when an in-person visit is a must.
There will never be a substitute to the real one-on-one interaction with a provider.
And remote health monitoring devices means keeping better tabs on patients.
It's allowed for us to be way more proactive in a patient's care.
That includes specialty services as well as diabetes education, physical therapy, occupational therapy, and speech therapy.
Telehealth also protects patients by keeping you at home.
It's certainly been literally a lifesaver in the age of the pandemic right now.
Learn more at connectednation.org/telehealth. Telehealth. It's an easy way to see your doctor.
I like telehealth because it is so convenient.
Over the phone, over your tablet, or over your desktop computer.
I believe it absolutely saves me time and money.
But in a Connected Nation Michigan study, 45% of respondents worry telehealth visits cost more than in-person appointments, something providers call a misconception.
I think that people are going to realize that it's a nice convenience. Instead of having to take the morning off to go to your doctor's appointment, you could potentially go in your car and do your visit.
The main place so far we've seen patients are saving money is for transportation expenses.
And because of the pandemic, insurance companies are covering telehealth visits, and providers are looking at long-term use.
Telehealth will be used to reduce cost of care.
I just think this is the future of healthcare, and you're only going to see it grow.
Learn more at connectednation.org/telehealth. Telehealth. It's a simple way to see your doctor.
What I would want others to know is the ease and that it does save time.
Over the phone, over your tablet, or over your desktop computer. But what about your medical information? Who is seeing that?
We are bound to the same, rigorous level of protecting their information as if they were stepping foot in a hospital, an emergency room.
In a study done by Connected Nation Michigan, 2 out of 3 respondents were worried about their privacy. But healthcare providers take it seriously.
That's probably one of the most important things about telehealth is the protection of the data.
In fact, the law requires it.
We have to ensure that all data is encrypted, that health information is protected, and we are accountable for that.
Patients can help by keeping their devices up to date and
Using a password protects unauthorized access to your devices.
learn more at connectednation.org/telehealth. Telehealth. It's not only easy, but on average, it means fewer trips to the doctor.
We can expand not just treating a medical condition, but the overall lifestyle and general health and wellness of a patient.
In 5 counties surveyed in a Connected Nation Michigan study, savings totaled nearly $6 million a year.
I think it's a great thing across the board, but in the rural setting is getting the bandwidth out to it.
62% of respondents say their providers offer telehealth options, but only 10 Michigan counties were telehealth ready.
Broadband access is important in order for telemedicine to really take off.
We need to work very closely with our hospital system and allow people the opportunity for telehealth.
Connected Nation Michigan is working to ensure everyone has access to telehealth.
We're working with local community leaders and the service providers to expand not only the access to it, but also the adoption and use of broadband.
Learn more at connectednation.org/telehealth.